any kind of government intervention will need to be holistic. Government needs to negotiate the cost of drugs. Government needs to negotiate how much hospitals can charge for care, and that just makes this solution like a 10-headed hydra. You cut off one head and the problem continues to grow. It's not going to be an easy solution.
Hello, everybody, and welcome. In today's episode, we'll discuss the cost of health insurance in the coming year. We'll also examine data gathered by LendingTree.com to understand the rising cost of healthcare and the factors contributing to them. And lastly, we'll look at recent events in the health insurance sector to see what the potential impact will be on the industry's future. Joining the conversation once again is Divya Sangameshwar, an insurance expert from LendingTree.com. Divya, thank you for coming here today and sharing your insights.
Thank you so much for having me.
No problem. So let's get started. So, according to these findings by LendingTree, which were published in November of this year, healthcare costs will go up overall in 2025. And the reason for that being is that healthcare itself is getting more expensive. So, why is healthcare becoming more expensive? Or rather, can we identify what specific factors are driving up the cost of healthcare?
Absolutely. So it's a amalgamation of things that are driving up the cost of healthcare, but the long and short of it is inflation, and specifically medical inflation. So by this I mean, the cost of treatments are rising. The cost of pharmaceuticals, that is your drugs that your average person consumes, they're getting more expensive. There are shortages for nurses, for doctors, and so that's also putting pressure on costs, because when there are fewer doctors and nurses and technicians, you have to pay them more. And in general, just the cost of research, the cost of everything has gotten more expensive. And this isn't a recent phenomenon, unlike economic inflation that we've been facing since 2022. This has been a problem since the year 2000, and it's such a complex situation that there really isn't like a single solution or a silver bullet, is if you want to call it, that we can use to address this. And so it just continues to grow. The cost of healthcare continues to grow. And then on top of that, we have a lot of mergers and acquisitions happening, which means fewer providers and, less competition. So that is an aspect of the situation as well. So fewer providers, less competition, rising costs, they're all getting passed down to the consumer in terms of higher insurance premiums.
How do company mergers affect cost?
So let me put it this way. So you live in Utah, for example, and 5 years ago there were maybe six or seven hospital networks, but then over the years, the six or seven networks decided to go through mergers, and that became two or three. So when you have fewer hospital networks or healthcare provider networks, what happens is they have more bargaining power when it comes to negotiating costs with insurance companies. And when there are fewer networks and less competition, they can set whatever prices they want. And we are stuck as consumers because we can't really shop around which network or which hospital we want to go to, if there are so few. And then more importantly, if we are someone with health insurance, then we're even more limited in the kind of hospitals or providers we can go to, because we prefer to go to someone who is in network, so that we don't pay for all of those medical costs out of pocket. So it just is a very complicated situation. A lot of big decisions are being made by businesses, and that ends up impacting consumers in ways that we may not even think about. And we may not feel immediately, but we will feel 10, 20, 30 years down the road.
Going back to the findings, one of the things about them is that it focuses on the price of insurance for people who are 40 years old or within the 40-year-old age range. Why was this age group selected for the study, and what was the rationale for not including other age groups?
So, to put it in perspective, anyone under the age of 26 will probably get insurance through their parents. And then from the age of 27 all the way to 40, your rates are pretty low because you're considered quite healthy. But when you hit the age of 40, that's when insurance rates start to rise because that's when you start getting all of the little medical issues that come with aging. And, that's also the age where you absolutely cannot go uninsured. If you're 27, you're probably in the best of the prime of your life. You have no health issues. You could probably not see a doctor for years and be completely fine. That changes when you hit your mid 30s and when you hit 40. We also consider that the 40 is for most people solidly middle age, and it's also one of the biggest populations in the US.
So the findings indicate that silver plans, which are a popular choice for individuals seeking health insurance, that is expected to average at $621 in cost, again, for 40-year-olds in the coming year. So, among large insurance providers, the data found that Kaiser Permanente is projected to be the most affordable option for that year, followed by Ambetter and Aetna. In contrast, there's Blue Cross and Blue Shield and United Healthcare, which are anticipated to exceed the average rate for health insurance in the coming year again. Now, as a reminder to everyone, not all insurers cover all 50 states, so it's best to check and see which insurers are available in your area. So, with that said, what coverage options and benefits do these insurance providers offer, and how can people compare them to find the best value?
I would say that rather than looking at the companies, I think it's important to look at the type of plan that's offered. So, I'm sure many of you have come across terms like bronze tier plans, silver tier plans, gold, and platinum. And it's a very pretty name, but I'll be frank, I didn't know what that meant until I started working in this as an insurance analyst. And basically, what it means is the metal tiers indicate how much you'll pay out of pocket for care. So if you're getting a bronze tier plan, you can expect to pay 40% of your medical costs out of pocket while the insurance company covers 60%. If it's silver, it's 30% out of pocket, insurance pays 70%. Gold, 20% out of pocket, and then insurance companies pays 80%, and then platinum plans, 10% or less out of pocket. So the reason why I bring this up is you cannot be making decisions on what kind of insurance you're getting purely based on cost, because that is just one factor. It's so important, especially if you are in your 40s or hitting that stage of life where you're starting to get medical issues that need attention. You need to pay attention to what your unique medical needs are. So, are there specific providers that you need to see on a regular basis? Do you need regular testing? Are there medications that you need to take on a regular basis to treat health conditions? Do you need to see a mental health provider? Do you have a specific provider that you prefer? Do you need a physical therapist? So, what I suggest when you're shopping around for health insurance is to actually make a list of your medical needs and then use that as a reference point to shop. So, if your plan covers all of these needs and it is at a price point that is affordable and you feel like, oh, I can cover that out of pocket expense. So, maybe bronze plans may not work for you because it's a huge section of expenses that you will incur, but silver plans could work because it's slightly less. It's only 30% out of pocket, and you're getting the kind of coverage you need from that plan. Then go for it. And the cool thing is, every state will give you at least three providers to compare from. 97% of Americans who are shopping for a plan on the Affordable Care Act exchanges will be able to have three providers they can compare and pick one that works best for them. So you may also come across terms like HMO, EPO, PPO. HMO and EPOs tend to have slightly narrower networks, so that means your list of providers may be fewer. You may not get as many drugs covered. PPOs, which are the most traditional form of health insurance, tend to offer the best coverage. So if you're someone who has kids, maybe look into a PPO, especially if you're planning to travel regularly within the US. having a plan that has a slightly more expanded network will give you more peace of mind. If you're visiting grandpa and grandma in Florida, and your network doesn't have any providers in Florida, your kid gets sick, you may have to pay completely out of pocket for, healthcare. So these are some considerations I think people need to keep in mind when shopping around for health insurance. It really shouldn't be, oh, that's the cheapest, I'm going to go with that.
So, speaking on the different factors, because I know the data looks at obviously age, like we talked about, but there's also region of the country, where you live in the country, that affects how much a person pays for health insurance. So, what other factors are there to consider? What else is there to know?
So, for example, I know you live in Utah, right? And Utah actually isn't one of the cheaper states for health insurance. In fact, premiums in Utah are rising 13%. That's nearly 1.8 times faster than the national rate increase. And you're without subsidies in Utah, you're probably going to pay $8,100 a year for health insurance. But the cool thing is, most people in America who shop for health insurance on healthcare.gov and any of the state exchanges qualify for subsidies. And in every state, the amount of subsidies you get can be quite different because it's tied to your income. Now, in Utah, I'm bringing that up because you live there. Uh, you know, we're talking $48 per month is what you're going to pay with subsidies. And 95% of Utah residents who sign up for health insurance through healthcare.gov or state exchanges qualify for that. And one in two residents can even get plans that are $10 a month. And I'm talking silver plans. So you're not going to be paying the unsubsidized rate unless you are in that bracket of income that doesn't allow you to qualify for subsidies, and that's over 400% of the federal poverty level. So, if you are hesitating to sign up for health insurance thinking it's going to be very expensive, don't, because you probably will qualify for some kind of subsidy that will reduce the price of your insurance coverage significantly.
So, speaking on that, the findings from LendingTree show that the Affordable Care Act, or what is commonly referred to as Obamacare, was the most affordable option for health insurance. Now, I think we covered a little bit about subsidized coverage under the ACA. Now, referring to the data, it said that most people who buy coverage from either healthcare.gov or a state marketplace, they don't pay the full monthly cost for health insurance. It found that more than 90% of health insurance plans from healthcare.gov or state marketplaces receive rate subsidies, like you mentioned. Now, these subsidies lower the monthly cost of health insurance. It found that about 4 in 5 people, according to this data, can get health insurance for $10 or less per month. And for anyone who might not be aware, how do subsidies again make health insurance more affordable, and how can people find out if they qualify for them?
So basically, what subsidies do is they will look at your income level and set rates that are reasonable based on your income level. So this could be so subsidies could exist in the form of tax credits, or they're going to pin the amount you're going to pay on your income. So I believe under the expanded subsidies that were introduced under the American Rescue Plan, they pinned it to 8.6%. So your premiums will not exceed 8.6% of your income. And this has helped reduce the cost of health insurance for many millions of Americans. And what ended up happening is, 14.1 million Americans enrolled in health insurance because of subsidies, because it made health insurance affordable to them. And the reason I bring this up is, that expanded subsidies that I'm talking about are set to expire in 2025 unless the government decides to extend them. And it's pretty much in the air right now because there has really been no indication that they want to extend these subsidies. But let me tell you what's going to happen. Millions of Americans are going to go uninsured because people who are dependent on these subsidies are probably going to see their premiums double. So it's going to create a lot of confusion and potentially an uninsured crisis if people just drop health insurance because they cannot afford it, or people may sign up for really bad health insurance plans because that's pretty much all they can afford. So subsidies are how so many of us are affording private health insurance, especially if you are working at a company that doesn't provide health insurance, or you're a freelancer, so you have to take care of that yourself, or you're just currently not working, or you are in a situation where you cannot get health insurance through other sources, like you're not qualifying for a government health insurance, like you're not above 65, or you're not making 138% of the federal poverty level to qualify for Medicaid, or you're not a veteran. So there are people who are in that weird gap of not qualifying for public assistance, and also getting health insurance for the first time because they're getting subsidies. But when those subsidies expire, when Medicaid expansion rolls back, you're going to have hundreds of thousands of people who wouldn't qualify for subsidies, and they also wouldn't qualify for government assisted, government health care. So that's going to create a bit of a crisis situation.
So people can just apply for it and find out until then if they qualify for these subsidies, correct?
Yeah, 100%. So the way to find out what kind of subsidies you qualify for is to go on healthcare.gov or your state's health insurance exchange, and there will be information on subsidy calculators. Like they will have a link that will say, here's how much of a subsidy you can qualify for. The other way to find out is, when you're filling out the form, they're going to ask you what your income is, where you live, your name, etc. And people might wonder, why are they asking for that information? The income information is what's used to qualify to calculate your subsidies. So don't hesitate to fill it out. If you're nervous about putting information on an internet form, a lot of these exchanges also have agents numbers that you can call and talk to directly. So if you're someone who doesn't feel comfortable filling out a form on the internet, you can always reach out to that age to the healthcare.gov or your state exchange and ask to speak to someone who can help you sign up for health insurance.
Let's talk a little bit about again the exchanges, because for anyone who might not be aware, can you sort of break down and explain what marketplace is and how it works in terms of selecting health insurance?
100%. So, one of the things that was very important with Obamacare is the introduction of healthcare.gov, which is a website that allows you to shop for health insurance plans. And these plans that are in healthcare.gov are ACA compliant, which means that they have to cover certain list of conditions that are expected to if you want to be called an ACA plan. So they can't deny you coverage for a pre-existing condition. They have to cover emergency visits. They have to cover primary care. They have to cover preventative care. So there's a list of things that they're supposed to cover, and those are the plans that are listed on healthcare.gov. So when you go on that website, it's going to ask you what your zip code is, what your age is, and then you fill out a form with some basic information like your age, your zip code, your income, and it doesn't have to be specific. It's just like a range. And then they will populate a list of plans that are available to you of every single metal tier. So you'll get to see bronze plans, silver plans, gold, platinum plans, and you'll see, HMO, EPO, PPO plans, and it will give you a brief description of the benefits each plan has. Sometimes it can be overwhelming because you're going to face 10, 11 options. So that's why I brought up how to look at the metal tier. So if you've decided, hey, I want to go for a bronze plan this year, then you can compare all of the bronze plans side by side. If you've decided, I think I can go for a silver plan, then you can compare all the silver plans side by side. Sometimes you may find a gold plan is slightly cheaper than a silver plan, so you can look at that too. But if something is significantly cheaper, then you also want to do a little digging into what it doesn't specifically does not cover. So if you're not sure what each plan covers and you're, kind of struggling to make that choice, that's when you speak to an agent or you call up the insurance company and ask them, hey, what does this cover? Like, does it cover this medication? Does it cover this provider? The cool thing is, once you sign up for health insurance, you're locked in on that rate for the whole of 2025. So you're good. You're not going to see your premiums rise halfway through the year. You're also going to be getting more or less the same providers for the whole year. That's why it's so important to shop around for insurance every year, because the list of providers can change, the list of medications covered can change. So you don't want to set and forget it. You just want to make sure that you're on top of it, advocating for your own healthcare by shopping around, comparing plans, and making sure that you're getting the health coverage you need.
So, going back to the ACA, there has been a push in Washington to replace the ACA with something else, but politicians have not been able to present a replacement for it as of yet. What could happen to people and even the healthcare market if a viable replacement for the ACA isn't found?
So there are two proposals that that are gaining popularity. One is to repeal the ACA completely and just leave health insurance in the hand of insurance companies without any regulatory oversight. What will end up happening if that comes to pass is we're going to go back to the way things were before the ACA was passed. So insurance companies can say, "Hey, I'm not going to cover you because you came to me with a pre-existing health condition." And actually, if you look at historic data under the old health insurance before the ACA, women paid significantly more for health insurance because for many of them, pregnancy was considered a pre existing condition. And then they would also be paying a lot in out of care costs because companies just won't cover the cost of pregnancy. Um, and then you're also going to see really sick people who need health insurance. Finding out that health insurance company isn't going to cover, say, the cost of their cancer treatment because it may have been considered a pre-existing condition. You have diabetes. You're trying to shop around for health insurance. You sign up for a new company. They're going to say, "Oh, you had diabetes before you signed up, so I'm not going to cover you." So it's going to create a crisis of medical debt. To be very frank, it is medical debt is already the worst kind of debt Americans can have. 60% of Americans have medical debt, and it is the only kind of debt that can completely cripple you. Um, so you have the ACA appeal as one of the viable alternatives. The other alternative is Medicare for all. And that sounds really great. That means every single American gets health insurance from the government. The problem with that is it's very expensive for the government. So I don't know how much support they're going to get in Washington to fund a program like that. And there's also fears that, with a program like that, are people going to be able to access healthcare, because then doctors and government officials are making decisions on the kind of healthcare you're going to get. My response to that is doctors and insurance officials are already making those decisions. So, government sponsored healthcare could be the way to go. Personally, as a human being who cares about fellow human beings and thinks that healthcare is a right, a human right, I hope some form of government sponsored healthcare comes to pass. But it will not be an easy path ahead. And it's probably going to be very limited. And looking at just health insurance doesn't address the bigger healthcare costs issue, right? Having health insurance alone isn't going to um, reduce the amount of money people are paying for pharmaceuticals, for example. So any kind of government intervention will need to be holistic. Do they government needs to negotiate the cost of drugs, government needs to negotiate how much hospitals can charge for care, and that just makes this solution like a 10-headed hydra. You cut off one head and the problem continues to grow. It's not going to be an easy solution.
I'm trying to find a way to bring this up. Because there's health insurance, right? And then there are also like vision plans which are not covered under health insurance. There's dental plans which are not covered under health insurance. How is has it been looked at? Or I know that the data from LendingTree didn't look at that, but is there a way to know how these other forms of coverage might be affected?
So as of now, if they repeal the ACA, what will end up happening is you may not have access to as many vision plans or dental plans. Those plans aren't technically under the ACA, they're not governed by the ACA, even though we're seeing an increased movement among certain politicians to make dental and vision insurance part of health insurance and not separate. Because so to put it in perspective, vision insurance and dental insurance don't work the same way as health insurance. they have very limited maximums that you can spend on. So, for example, if you get a dental plan, they're going to say, "Oh, they will only cover $10,000 in expenses," for example. Which means if you need a root canal, you're probably going to pay an additional $5,000 more because root canals are not cheap. With vision insurance as well, there's a very limited number of opticians or optometrists that it will cover, and most of them are really expensive. And then when you factor in the cost of getting eyeglasses or contact lenses, it's also expensive because vision plans aren't going to cover the entire cost. They're only going to cover like part of the lenses, so you have to pay out of pocket for the frames. If you want like higher end lenses, like transitions lenses, or you know those multifocal lenses for people who have both near and farsightedness, they're going to cost a pretty penny, and vision insurance doesn't cover that entire cost of making a pair of glasses, even though they should. um, so it definitely, those are two kinds of insurance that need reform. And what's ending up happening is, yes, they're getting more expensive, but they're also not really um, covering enough. So what I mean is, they're not really taking into account the cost of care. So you're paying more for a product that's not really going to help you in terms of covering all of the costs. That's not to say don't get it, because it's still going to cover some of the costs and it's still going to save you a significant chunk of money. But that's how it is right now. And I hope that in the future, they're going to get rolled into health insurance so that every aspect of your health, your eyes, your teeth, your body is covered, and your mental health is covered by health insurance.
So going back to the lending tree data, there were some costs that went up in some states over the year, throughout the year. So, for example, Vermont saw a 27% increase in health insurance costs this year, again, according to the lending tree data. But there were some states that actually saw a drop in costs. So, for example, like in Iowa and South Dakota, data found that there was a 7% and 4% drop, respectively, in the cost of health insurance. Now, going back to the factors affecting health insurance costs, what caused Vermont's health insurance costs to go up while Iowa and South Dakota's and a few others went down?
So just to preface this discussion, insurance companies cannot raise rates at will. It's part of a long negotiation they have with the state's insurance regulators, and they have to explain why they're raising prices, why they're raising premiums. So they have to explain, oh, it's because the number of claims have gone up. The math is pretty simple. Your premiums go up if there have been a significant increase in the cost and the volume of claims in that area. So, in a state like Vermont, for example, it is a state that's seen an increase in population because you're getting a lot of people coming from other states, but it's also a state that has an aging population. And these are people who wouldn't qualify for Medicare, but they're still in that age group that needs health insurance, and they have to get private health insurance. So, Vermont is one of the states where, there's an aging population, there's an increased demand for healthcare, and that's pushing rates up. And, Vermont and even New York are states that have very stringent requirements for what health insurance plans should cover. And the more conditions they add that are required under compulsory coverage, the more your premiums will go up, because insurance companies are going to see that as, well, I'm taking on more risk. So I need to pass that on to consumers in the form of higher premiums. Whereas in states like South Dakota, where premiums are falling, keep in mind they're not huge decreases. They're actually less than 10% compared to 28% in Vermont. And this could be just due to the insurance companies saying, oh, we haven't had that many claims this year, so we can afford to reduce premiums a little too, just a little bit. Or it could be because they're having new insurance companies coming in to compete. So when that happens and you have more competition, then they're all going to try to lower their premiums to compete for business. And for those two states, that is what we found. It was just fewer claims and then more competition, leading to slightly lower rates to attract more signups.
So, speaking on just the health insurance industry as a whole, the national discussion surrounding health insurance and costs, and the reason why we're having this discussion, and it has gained prominence following the assassination of United Healthcare CEO Brian Thompson on December 4th. Is there a way to gauge or to know how the health insurance industry will move forward after this event, especially given some of the public responses to the situation?
Um, Let me put it this way. I think the situation is evolving, and it's best that we not speculate at this stage while the investigation is still ongoing. I don't know how the health insurance industry will react. I don't think they're going to react to one event, but it's definitely a large event that has rattled people. And, my prayers go out to, the family of the deceased. However, it's too early for us to say what its impact will be.
So, one of the biggest criticisms of the insurance industry, particularly with United Healthcare, which has been one of the biggest ones, is the number of claims that get rejected. In fact, there was a news story here in Utah a few days ago where a man named Ryan Barub, who has muscular dystrophy, and is on a ventilator tube, was denied a chair by United Healthcare, and that his physicians say he needs. Now, United said in the news report that they're looking into Barub's case. So, how do health insurance claim denials affect overall healthcare costs? And how do they contribute, if at all, to rising insurance expenses?
So it's really difficult to draw the line between claims denial and what we pay out of pocket for health insurance. But yes, it does affect what we pay out of pocket for healthcare as a whole. And I hesitate to draw the line between denials and rising overall healthcare costs, except to say that with healthcare becoming more expensive on a whole, insurance companies will try to see how they can reduce their expenses. And, the ways they're going about it might not be very clear to us as consumers because they don't always tell you how they're looking at claims or denying them or approving them. And it's easy to paint someone as a villain, especially when you're in a tight situation and you need care. However, I just want to point out that if your claim is denied, that isn't the final step. You can appeal your claim. You can reach out to insurance regulators in your area to ask for help, and as you rightly pointed out, reach out to the media. So there are lots of people who can advocate for you if you find yourself in a situation where your care is being denied, or your claim is being denied. It might be a simple error that can be fixed. It's this entire claims process is a negotiation, so it's always important to not take the first response and advocate for yourself. Reach out, talk to your health insurance company. If you that's something you don't have the time to do, appoint someone for it, a family member or a healthcare advocate. Every hospital has one. Reach out to them and see how they can negotiate for you. Your doctors will do it for you. A lot of them write great letters letting insurance companies know why this care is critical. um, just don't take the first claim denial as final. You can negotiate it and you can probably find a compromise.
So, we've covered a lot regarding the cost of health insurance. So, what important points should people remember or keep in mind when dealing with health insurance costs and coverage options today?
Couple of things. Before you sign up for health insurance, don't always sign up for the cheapest. That might not be the best option unless you are facing significant financial hardship, in which case, look into subsidies before you make those decisions. It is important when you sign up for health insurance to consider your unique medical needs, your family members' medical needs. If you have kids, you may need to account for emergency medical needs, because kids being kids are going to fall down, get hurt, and get into all kinds of shenanigans. But more than that, on top of having health insurance, if you can get a plan that allows you to have a health savings account, which means you can save some money tax free in that account and put that away in case of emergencies, that will give you an additional cushion and give you a little peace of mind. If, however, you are someone who doesn't have the extra cash to save for medical emergencies and you just can't afford health insurance this year and you plan to go uninsured, it's not against the law, but I strongly don't recommend it. If you are, however, in that situation, there are options for you. It's not like you don't have health insurance, you can't get care. There are community clinics, churches run a lot of clinics, community centers run clinics, and those clinics can offer you free preventative checkups and primary care at the very basic level. If you need medications, maybe don't get it from CVS because that might be expensive, but you can look for accredited online pharmacies that offer drugs at slightly lower rates. Cost plus drugs comes to mind. Amazon comes to mind. They're offering a lot of drugs at slightly cheaper prices, so you don't feel the pinch even if you're buying it without health insurance. And some pharmacies will also help you. Some pharmaceutical companies will help you get drugs with coupons if you reach out to them and say, "Hey, I don't have insurance, but I need this drug. Can you send me some coupons?" They'll hook you up. So there are options for you if you don't have health insurance. If you can afford it, try to get some kind of health plan, whether it's a bronze plan or a catastrophic coverage, just to give you some peace of mind in case of like a dire health emergency. But if you absolutely are not getting it, like I said, health discount cards, community clinics, online pharmacies, and if you're stuck with a huge bill, crowdfund it. Many Americans have successfully crowdfunded their medical bills. It's a great way to pay off debt, um, and save up a little, adjust your budget, and get health insurance next year. Don't be without health insurance for more than a year because you're just increasing your risk of significant medical debt if you do. The one thing you don't want to do is skip care. Like, I don't have health insurance, but you feel funny. Don't say, "I'm not going to go see the doctor," because then your health problems will get worse and you'll end up paying a lot more to treat those health conditions.
So, speaking on that, how do preventive care and wellness programs impact health insurance costs? And what should people know about using these services to save money?
Absolutely. So, what preventative care and wellness programs do is help you improve your overall health. And that will help you not use your health insurance as much to treat illnesses. So, for example, my company has a great wellness program, and they'll give us a discount if we uh, commit to doing a certain amount of exercise each day, or if we go get our blood work done on an annual basis to make sure that we're our sugar numbers and our pressure numbers and cholesterol numbers are within acceptable normal ranges. Some programs even cover weight loss programs, like some preventative care and wellness programs that I've come across say that they'll cover consultations for weight loss and they'll give you free coverage for dietitians. Some insurance programs, wellness programs also cover gym memberships. So if you're in the position where you're healthy enough to take control of your health and get healthier, insurance companies want you to do that and they will support you. So if that information isn't immediately obvious in your health insurance plan, call up your insurance companies because a lot of them have these programs, but they're not clearly advertised. Preventative care, which is going to the doctor for your annual physical, almost every insurance plan has that for free. So take advantage of it. If you're a woman, your well woman visit with your gynecologist, that's covered for free. So take advantage of it. If you are trying to overcome a diagnosis of, say, insulin resistance, then your health insurance company will actually cover the cost of a dietitian because a lot of this comes down to diet as well as medication. So, you know, call up the insurance company and find out what programs they have that will help you to overcome some of your health challenges. And if you take control of your health early, then the problems aren't going to develop to the point that you're going to need regular medication and testing. And, it's not going to raise the cost of healthcare as much.
So, like I said, we've covered a lot today. Is there anything else you want to add that's important that maybe needs to be addressed?
100%. So the deadline to sign up for health insurance is January 15th and by January 15th of next year. So when you sign up on 15th of January, you're going to get covered for February onwards. The deadline to sign up for insurance for January coverage was actually yesterday. So it's all right if you missed it. Make sure you sign up before 15th of January to get covered for the rest of the year. Um, and if you happen to be someone who lost your job in the middle of the year, that's a special enrollment period. So you can reach out to your state's health exchange and let them know, hey, I need health insurance, and they will open a special enrollment period for you to sign up. Other special enrollment periods include you discovering that you are about to have a child, so then you want to upgrade your insurance coverage to include that unborn baby. You can get more coverage in that time period. So if you lose your insurance coverage midway through the year, you're not stuck that way. You can always get covered almost immediately after.
So, we've been speaking with Divya Sangameshwar from LendingTree.com on what people can expect regarding health insurance costs in the upcoming year. Hopefully, this conversation has provided some helpful insights to help people navigate their options and make informed decisions in the year ahead. Thank you, Divya, for taking the time to speak on this today.
I'm so happy I could talk about it. And, I hope that everyone listening in leaves this session a little more enlightened about the kind of health insurance options available to you and empowered to make the best decisions for your health and your family's health.